So this is session 201, training the advanced practice provider in urology. So I am going to introduce the speakers, but first I just want to introduce myself. My name is Christy Krieg. I am the treasurer and president-elect of the certification board of urologic nurses. And I think what we're seeing a lot at this conference is the importance of specialty-specific training. And obviously we're going to be talking about urology fellowships today for nurse practitioners. Certification is another step that you can take to improve your learning and validate your role as an expert in the field. So you might have been trained in something general like family practice or adult gero, but becoming certified is just another step you can take. And I saw people at the booth last night. Some had been in urology, not even entered urology. Some people are here at the conference who are going to be starting in urology in the next couple weeks. Other people were saying, I've been in urology 17 years and I just got certified. So it's never too late. And you just have to have 2 years of experience. So let me know if you have questions about certification. Okay, so I'm going to introduce our speakers now. Meredith Donahue is a nurse practitioner at Vanderbilt University. Before working at VUMC, Meredith graduated from the Furman University in 2015 with a Bachelor of Science, and she received her Master's in Nursing from Vanderbilt University School of Nursing in 2018. After graduating, Meredith completed the Vanderbilt Urology Nurse Practitioner Fellowship from 2018 to 19, and she's now the director of that program here at Vanderbilt. So we're excited to have you. Gilbert Kamola graduated with his master's from Goldfarb School of Nursing, completed a urologic fellowship at Washington University in St. Louis, started and directed a urologic fellowship for APPs at Vanderbilt University, and now directs the APP program back at WashU. So we're excited to have you both, and thank you for coming to the conference today. Thank you.
All right. Well, I'm going to get us started. So this is training APPs in urology. We'll look at, so these are our objectives. We're going to look at kind of how we're trained in our formal training. We're going to talk about growth and utilization of APPs in urology. We'll talk about onboarding for APPs and also APP fellowships. I wanted to start the talk with a couple of questions, and I hope, yeah, this looks like it'll work. So there's a QR code that you can scan on your phone so you can answer, and it should populate as you answer. So the first question is, did you receive urology training in your primary education? So in nurse practitioner school, PA school, just curious what the crowd majority is. So 14% yes. Oh, okay. I'll give it a little time for y'all to respond. So, yeah, I didn't say how much training. Let's say more than like a few hours of urology training. Okay, 80-20. Going down a little bit. Okay, so 85% or so don't receive any training. Okay. All right, next question is, how long did you receive training in your practice? When you started working in urology, first job, how long before you were seeing patients independently on your own? Ooh. You have to scan the QR code each time. Sorry, I couldn't figure it out how just one would work. Okay, great. It did with just the one? Oh, wow, okay. Beautiful. All right, so most people 1 to 3 months. Okay. All right, and then last question, how long did it take for you to feel comfortable practicing in urology? Okay, so looks like more than a year for most of us. Okay, great. All right, so we'll get started here then. So advanced practice providers. So the first APP program, surprisingly, began the same year, 1965. First PA program, first MP program. They both came out of a primary care physician shortage, and both basically focused on primary care in their education. The use of APPs has expanded into specialty practices, And there was about a 22% growth of APPs reporting they practice in some type of subspecialty between 2018 and 2016. About 30% of NPs report working in specialty practices, and a little over 60% of PAs do. We've seen that type of growth in urology as well. So 2018, over 72% of urologists reported working with one or more APP. That was up about 10% from 2015, when only about 62% of them reported that. The data here is from a study done in 2016 looking at the predictions of the urology workforce over the next 20 years. And the use of APPs in urology is predicted to nearly double by the year of 2035. And then the number of urologists is going to decline pretty significantly. If we look at APP utilization in urology, most of this is from AUA surveys sent to AUA members. Most APPs report practicing in private practice, a little over 50%, and then just under 45% are in some type of institutional practice, such as academic medicine or like VAs, military hospitals. The primary area that they practice in is going to be in the clinic. So a little over 70% work in the clinic, and they say that that's the main place that they're going to work. Less than 30% say that their main area of practice is going to be inpatient, ORs, or non-academic like research, that type of thing. Then if you look at practice focus, most of us are going to say general practice is kind of what we do, general urology. But some are specializing in like oncology, pediatrics, female pelvic medicine and reconstruction, men's health, and other subspecialties. This is kind of a busy slide here. There's a lot of procedures that are on here. This is also from kind of surveys from AUA members of what procedures they perform and the percentage of them that are performed independently versus with a physician. About 63% of APPs in the survey said they did moderate to highly complex procedures in the office, with about 25% of them saying they either did cystoscopies or biopsies. Cystoscopies could have been non-diagnostic, but still a pretty good number. So this leads to the question of like, we're having a lot of APPs coming into urology. We're doing a lot of things. How are we trained? So we receive little to no training in our formal education. Most of us, as we saw here, at least in this room, are going to have on-the-job training. That it lacks standardization, it can vary in quality, and varies in length. There are things such as the APA or the AUA core curriculum and other like SUNA and other places where you can get education which can aid in your training, and there are also fellowships that can help, but they are somewhat limited. So if we look at transition to practice for APPs, about 50% of new APPs report feeling underprepared within their first year. They often state that they feel a lack of mentorship and support, which also often can lead to increased turnover and job dissatisfaction. That becomes burdensome for them and also their employer, as it usually is going to take an APP somewhere between 6 to 12 months to become productive. And that can, like turnover costs can be quite expensive, sometimes more than 1.5 times their salary. So having some form of structured postgraduate training may be helpful. The AUA does recommend, or at least say this in their consensus statement on advanced practice providers, say it's the goal of the AUA and practicing urologists to develop a process by which newly graduated APPs would undergo a period of mentorship, training to cultivate a practitioner capable and willing of independently managing a wide variety of urologic conditions.